the Interfaith Healthcare Association of Manitoba and the Manitoba Association for Residential Care and Community Care Homes for Everyone, MARSH. And as part of that placement, I was asked to host a series of conversations around the themes of Spiritual Health Awareness Week. And this year, our theme is breaking the myths of spiritual care and psychospiritual therapy. Um, so, despite its important role in many professional settings, spiritual care is one of the most misunderstood professions in Canada. Many of our members encounter misconceptions and false assumptions regarding their work. And so this year, the goal was set to educate our communities about the profession by breaking the myths surrounding spiritual care. We want to try to push back or dispel some of the myths floating around in our community regarding spiritual care. So we've put together this series of webinars featuring some prominent spiritual healthcare providers here in Manitoba. And each interview will tackle a different aspect of the common misconceptions as we attempt to break the myths. So today, this is our first in our series. We are debunking the myths, what spiritual care really is. And today I'm joined by Tim Freimeyer. Tim retired in 2016 as the coordinator of spiritual care at Riverview Health Center, where he taught clinical pastoral education in addition to his assignments on both long-term care and chronic care units. Originally from Kamloops, Tim says he moved to Winnipeg for the weather and the insect life. Tim received his master's degree in family and group work, which proved to be a little help in helping to raise a large family along with his wife. Tim has an abiding interest in making spirituality both interesting and fun. His motto, life is too important to be taken seriously. At age 67, he's faced with the daily evidence of what he told me was his body's gradual slide into old age and decrepitude. Tim told me that he's honored to be speaking with us today to break some of the myths of spiritual care. So, welcome, Tim. Thank you for joining us.
You're very welcome, Trevor. Good to be here.
Um, so, in your experience, what do most people think of when they hear the phrase spiritual care? What are some of the misconceptions floating around out there about the field?
Yeah, and that's such an important question because it's the first issue you have to deal with as a spiritual care provider when you walk into a room, because immediately you become the screen upon which patients, nurses, staff, families will project their assumptions, their biases, their often myths about
Mhm.
what you're there to do, who you are, and so sometimes their first reaction tells you a lot. You can see when you say, "Hi, I'm Tim, I'm from spiritual care. Is it okay if I come and talk with you?" And they'll right away, if they have that kind of welcome eagerness or this
Mhm.
guarded suspicion, you can see, oh, I've got some work to do to dispel some myths or some preconceptions. And I probably the first myth I would say that kind of raises its head is they conflate or assume that religion and spirituality are the same thing. And so that might work for you if they are devoutly religious and are happy to see someone they assume will be religious. It could work very much against you if they assume because they are not religious and they assume you are, then,
Mhm.
oh, I don't need you or want you. There's some assumptions about what a religious person might be there for. So that's a big one, just to tease apart. I'm here for to support people in their spiritual life, not, and if they happen to be religious, I can support you there too, but they don't have to go together. So that's the number one myth I think that causes a lot of trouble for spiritual
Mhm.
care providers is people conflating spirituality and religion, and that I must do be there for both. Mhm.
Mhm. So you find people, as you said, they're initially guarded for fear you're there to judge them or to see how well they're living up to a certain set of principles they think, or. Yeah.
Yeah, exactly. And in fact, if someone was raised religious, that happens almost immediately. As soon as you identify yourself from spiritual care, if they haven't been going, say, to church like they were
Hmm.
raised, right away they'll
Hmm.
be in an apologetic, yeah, I was raised Catholic, but I don't go to church anymore. And often a bit, um, like you say, embarrassed. And so that's already a roadblock in building relationship if my presence makes them feel guilty or if they feel embarrassed or shy, then that's I have work to do then to build some trust beyond their suspicion that I'm here to judge them or that
Hmm.
my very presence makes them feel guilty because they feel guilty about perhaps not continuing in the faith that they were raised in. So
Hmm.
yeah, that's a big issue.
So then, right then you're often presented with a challenge the minute you walk through a door. So
Exactly.
how does that perception that people may have line up with the reality of what spiritual care actually entails in a healthcare setting?
Yeah, hopefully, if they let you stay in for more than a few seconds,
Uh,
sometimes it's get out. I don't
yeah.
want you. You darn religious people are always peddling you Bible thumpers, or they have
Hmm.
their pre. And if they order you out, you can say, "Well, I'm not here to do what you think." And if they say out, then
Yeah.
sometimes you're out. But if they do allow you to explain, if the first thing I like to do is just tease apart this notion that I'm here for your spiritual needs. And that whether or not you are religious or attend church or even believe, every human being has spiritual needs. And that's my role here is that you're here in the hospital or in a healthcare setting, and it's often a time of crisis, a time of some pondering, and their world has been shaken up. Often it's a time for introspection and wondering. And so spiritually, I can support people, as they're asking tough questions about, will I live? Will I die? If I live, what kind of life do I want to get back to? All of those existential questions that are triggered by illness and crisis, they're dealing
Hmm.
with them. Sometimes well, sometimes not so well. And spiritual care is really meant to support people spiritually. So that's the first thing I try to kind of tell folks is that we're here for you spiritually. And I've had some people say, well, I'm an atheist. I don't have a
Hmm.
spirit. And I would say, well, actually, in my definition, every human being has a spirit. It's the way you answer the question of where's meaning and hope, what makes your life of value. And they answer those questions too. They find meaning and purpose. They have values, deeply held values. And when I explain that that is your spirit, that's part of your humanness, and seeking answers to those deep questions, then they say, oh, okay, I have that. I don't call it spirit. So
Hmm.
they may object to the terminology, but in the end, they agree that, yeah, as an atheist, I have values and meaning, purpose. And yeah, if that's what you want to talk about, then yeah, come on in.
Hmm.
So, so everyone has spiritual needs, especially when they're in hospital or in a healthcare setting, because that just seems to trigger and bring out uh, those issues.
And do you find that often helps when you reframe it that way as I'm not here for religious care, I'm here for spiritual care. And as you said, spirituality as you define it, not as I define it.
And that's the key point, what you just said, Trevor, that as you define it, we're there to help them with their issues. I'm not here to push any agenda of my own. Every spiritual care provider usually comes from a strong faith base. Then there's
Mhm.
the requirement, the training for to be a spiritual care provider is a master's level preparation in the theology of your own tradition or faith. And so,
Mhm.
yeah, I've got a strong faith tradition.
Mhm.
However, I'm not here to sell you on that or to push it at you or even to kind of have it be part of our conversation. I'm here to support you in your spiritual journey and your seeking answers in where you are right now. So it's the patient that sets the agenda, the client. It's up to them to say, well, here's what I want to talk about. Like it's really a patient-driven conversation, not about me and where I'm coming from or my theological religious background. In fact, that's part of the training for for chaplains or spiritual care providers is that they are specifically trained to focus in on the patient and try and keep their story out of it. And if you've ever been in a room where you've heard these conversations from friendly visitors or family members, they'll say, "Oh, you're here for a appendectomy. Oh, I had one of those, you know." And suddenly the story goes back, and pretty soon they're showing
Mhm.
scars and trading stories. Oh, yeah, I had that same anesthesia, and they're comparing it, and that's social conversation. It's not what spiritual care is trained to do. They're
Mhm.
trained to keep their story out of it. You can use it and
Mhm.
reference in your mind, but to keep the focus on the patient's story and their search for meaning and purpose, not
Mhm.
how we answered those questions. So that's a big part of the training. In fact, I'm wearing the T-shirt that this is
Mhm.
the unofficial motto of CPE, or Clinical Psychospiritual Education. That's the training that people take to become hospital spiritual care providers. And we say trust the process, meaning
Mhm.
that when you work on yourself as a spiritual care provider, that will equip you well to help others. But first, you have to get your stuff out of the way. You have to do your work first so that you can be truly present for the patient.
See, that's really fascinating to me to hear you say that. And that's what I would think would be another stumbling block or myth for people to overcome, is that it's not easy to do that, that you can set aside your own strong faith upbringing, what brought you into the field in the first place, that your spiritual care providers are able to set that aside to a degree and aren't coming at it with a bias or an agenda or a specific lens, or eventually, you know, you're going to try to get a person to think the way you do. Maybe that's part of the barrier that people, why they have that reaction.
No, that's well said, Trevor. That is very much the case. Uh, the training for spiritual care providers is that you are meant to be interpreters on many levels. Maybe the first level is that the doctor comes in, they give the diagnosis, they leave, they're busy, they can't. So the chaplain, spiritual care provider comes in,
Mm.
and now the patient has all sorts of questions. Well,
Yeah.
what did they say? What does that mean? Like, in a
Mhm.
way, you help interpret some of the medicalese into English.
Mhm.
That's one level of interpretation. And then you help interpret, what does it mean if you have this diagnosis, this chronic condition, this surgery? What does that mean for your life? And so you
Mhm.
help interpret what how will you wrestle with these new limitations, if there are any? How is your self image and identity affected by now you have cancer? What does that mean if your life is not going to last as long as you thought? So you help people interpret kind of their reality, the medical reality, into their everyday language. And spiritual care people are skilled at that kind of interpretation. Uh, and the other part too is that the training, the master's degree that's required for this, it gives people a language and a facility to use the deep metaphors that's embedded in every world religion.
Mhm.
Um, whether you come from a Christian tradition or a Jewish tradition or a Muslim tradition, you are familiar with that theological world, and that you can not impose it, but you can use that theological background to help find the metaphor that fits for the patient. So if I'm talking to a patient who's nervous about their heart surgery tomorrow,
Mhm.
and let's say they come from a good Baptist tradition, and you might, the spiritual care provider would, knowing their Christian tradition, might remind them about the words of scripture when Jesus was in the boat and calmed the seas. And so maybe you feel like you're on stormy seas right now. Maybe this cardiac surgery is like a strong storm threatening to capsize your boat, and you're not going to sure if you're going to survive the storm. And just remember what Jesus promised, that fear not, I am with you, calming the storm. So you can help with knowledge of the religious tradition. The spiritual care provider can use those metaphors and deep truths of the faith tradition, bring it to bear in this particular crisis. Yeah.
Mm.
And I think the special skill of a spiritual care provider is that can do this across traditions. Uh, the main difference between, say, a spiritual care provider and, say, a priest, a minister, a rabbi, an imam, is that they are well trained in their tradition and they know their scriptures and they know their metaphors. What happens though when you move outside that, if you're not speaking to one of your congregations, someone who's not in your faith tradition, it's not as easy for them to actually put aside their theological world and enter into the other's theological world. And
Mhm.
that's the special gift and skill, I think, of spiritual care providers in hospital and healthcare settings, that their training specifically has allowed them,
Okay.
as you say, to not impose or to, they use their theological training, but they can walk out of it and enter to the other's world and speak
Mhm.
their language.
That's a really uh, helpful distinction between, what the role of, a rabbi or an imam or a priest and what a spiritual care uh,
Mm-hmm.
advisors do, what their role is and what their training is. And I think it'd be really helpful if more people were aware of that you do have
Yeah.
that specialized training that
Well,
allows you to, have not just empathy, but understanding and awareness and sensitivity and maybe humility towards those other worldviews.
exactly. And be underneath every world tradition and their theology, there are these human values of compassion and caring, of searching for beauty and searching
Mhm.
for meaning and purpose. Those
Mhm.
ground all faith traditions
So
and
more
spiritual.
universal
The
truths,
exactly
universal values, right?
universal truths and spiritual care providers are trained to access those universal truths that are it's embedded in every story. And we listen between the lines of a person's
Mhm.
story to try and name and articulate what is the spiritual need that's going on there. And so it doesn't really matter whether you're Jewish, Muslim, Christian, if the need is you're grieving the life you
Mhm.
had, and to help the spiritual care provider can help name that, can, and when something is named, then it becomes manageable. It became, you can do things with it, but until it is named, it lies in the background like a cloud almost. So help,
Mhm.
good listening can help the person name it, can help them articulate it, and then they can move on. It shifts things in a way.
Well, and then also like something else you said or were talked about really struck me is the role, for being a patient advocate in some ways that people can feel overwhelmed and so many conversations are, medicalese or they're centered around the system and you really come in and help the person to process that. And if you want to refer to that as spirituality, that's one way of describing it, but it's also, being person centered or patient centered and finding out what that person needs in that moment. Yesterday I went to a screening of a film at the U of M medical campus, and they had pharmacy students and medical students and nursing students and respiratory therapists. And we watched a movie about a true story, and the family was there, the father and the sister of a man who was, failed by the healthcare system. And at no point
Mm,
in his journey did anyone really advocate for him or help him.
mm,
And
yes.
he ended up not receiving treatment and passed away.
Mm.
And so that, what a huge role I can see for someone in spiritual care to help someone process what's happening to them.
That's exactly right, Trevor. Our goal is to, because we are members of the healthcare team and that we meet with the team, with the doctors, nurses, allied health people, we chart in the patient record. We're very much part of the embedded into the team.
Mhm.
We can often act in this liaison role because, as I said before, the doctor is given the diagnosis, they leave, and I go in there and I hear from the patient they actually didn't hear one word after he
Mm,
heard the word cancer. It's
yeah,
just like
yeah.
it. There
Shut
was, you
down.
know, in movies you hear the person talking, but all you hear is wah 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 wah. It's
Charlie
that's
Brown's teacher.
exactly that's the impact of a huge diagnosis that they're hearing you and they're nodding their head, but nothing is being integrated. And later
Mhm.
on, they don't know was said. And so
Mm,
the spiritual care provider can go back to the team and say to the doctor, the nurse saying, yes, they've been informed of their diagnosis, but because of their emotional state, not much registered. They're going to need to hear that again, maybe a few
mm,
times. And that's important information for the healthcare team to have someone who's privy to what did the patient really hear? Did they integrate in it? Did they really hear it? Were there misunderstandings? Often we can
mhm.
help the healthcare team come back and meet the patient where they're at. Yeah,
Or a question or a concern that they're afraid to tell the doctor or the nurse,
exactly.
ask them. But because you and your colleagues focus on relationship building and trust, they feel comfortable expressing it to you, and you can
Exactly.
express it to the rest of the
You're
team.
right. And that's our unique role in healthcare too. Often the spiritual care provider is meant to be the person that comes alongside the patient, listens deeply to their experience, and then can come back to the medical team and explain some of exactly what you
Mhm,
said, that they had questions they didn't understand, uh, or that once you understand someone's deep values, that what's being proposed by the medical team is not in alignment with the
mhm,
person's value system. And let's say, and it could work either way, the team is advocating lots of intervention, and the patient actually is more than ready to stop. And I've seen it the other way too. The healthcare team is saying, we've done all we can. It's time to move to palliative. And the patient isn't ready for that. And they want to keep fighting. And so often spiritual care providers help with that communication between families, patients, and healthcare teams. Uh, because the reality is that healthcare is so busy that
mhm.
doctors don't have the time to sit down and have longer conversations about deep values and how the medical treatment plan fits in with that too.
Not
Ideally,
because they
that
don't want to, just
exactly, yes.
right. Yeah,
Yeah. Yeah.
yeah.
Ideally it happens, but the reality is that we're way too busy in healthcare.
Mhm. Well, and that's that movie again that I saw yesterday. He just was bouncing around and the doctors weren't communicating with each other and he fell through the cracks and he wasn't
Mm-hmm.
advocating for himself and he ended up losing his life because no
Mm-hmm.
one was in the system on his team, on his side. They all meant
Yeah.
well, but
Yes.
yeah.
Mm-hmm. And here's a good, maybe a time, one of the big misconceptions that spiritual care providers have to deal with right off the bat is the circling buzzard phenomenon,
Oh.
like the vulture phenomenon, that I enter the room and hi, I'm spiritual care. I said, uh-oh, what's
Mm,
wrong? What didn't they tell me? It's worse
mm,
than I thought. Like they think
mm.
they only call spiritual care if it's bad news.
The angel of
So
death.
the angel of death, exactly. So
Mm.
one of the first things I need to do is I'm from spiritual care and everything's okay. I have to speak right
Mm,
before you can see the eyes widening and you have to kind of stop that right away. No, everything's fine. I'm just here to see how you're doing, because the first assumption is, well, they only call the spiritual care when it's
mm,
time to go to palliative care or bad news. Yeah.
mm, mm.
Mhm.
Well, um, so we addressed some of our questions just through our conversation. But
Mhm.
in what ways might you think that seniors would benefit from more attention being paid to spiritual needs by the healthcare system? And why do you think that doesn't always happen?
Mm. Well, and I think it's a multifaceted, complex explanation. There's a lot of things happening. One of them is our society's attitude towards the elderly,
Mhm,
where, and I've worked in PCHs for some of my career, and the prevailing attitude is, while all the staff are very caring, very giving people, that's why they're working there, the lack of funding for long-term care to
mhm,
have adequate hours of staffing, um, it results in that we're warehousing the elderly.
mhm,
And uh, social workers, recreation therapists, nurses, allied health, they do a great job. However, there's not enough hours in the day. So many people in long-term care often are parked in front of a TV. They put on The Price is Right or they put on
mhm,
a game show, and there's 12 people sitting around the TV. Only one of them really watching it, the others in various states of sleeping or just not there.
Hmm.
So unfortunately, the way we treat our our elderly is not the way they deserve.
Hmm.
And there's a lot of ageism in our society, so that as soon as you're not a contributing member of our workforce, you're not out there buying in stores, you're not consuming, your value goes down. And it may not be written anywhere, but the elderly feel it. They feel sidelined. They feel invisible. They feel like I don't contribute anything, so I'm a
Hmm.
burden. And so all of these attitudes kind of conspire that the spiritual needs of the elderly are also devalued. And when you think about the stages of life, when you're in your senior years, I'm 67, so I'm there now, I'm retired, there is a sense of you start thinking a little deeply about your life. So, how has my life been? What have I contributed? Where's been the meaning and purpose of my life? You start asking existential, deep spiritual questions about your life, often needing and would liking a little support, someone else to talk to about this. And those spiritual needs often go unmet because there is not enough staffing for people to accompany the elderly. Most of our province, the major hospitals have dedicated spiritual care positions funding them.
Hmm.
Not all nursing homes have that. Nursing homes, a lot of the faith-based ones, they have budget earmarked to hire spiritual care providers to meet
Hmm.
spiritual needs in long-term care. However, a lot of long-term care facilities, they do not have. All they have is the volunteer ministers, rabbis, priests, the local clergy that can come
Hmm.
and do a service.
So
That's
that's again, you're like, there's a distinction there. They might have, if it's a faith-based personal care home, they might have
yes.
the priest or the rabbi, the person of that faith background, but they don't necessarily have the spiritual care provider training that you were talking about before.
Right. Some do. Some faith-based institutions, long-term care, do hire spiritual care providers for that
Hmm.
reason, in addition to the priests and ministers who come to visit their congregants. But many don't.
Hmm.
So that's indicative, I think, in our society that we just don't value those needs as higher as other
Hmm.
needs. Yeah.
And what can we do to combat that, to the ageism, the marginalization, the funding,
Hmm.
what can we do?
Yeah, and part of it is kind of a slow education that every human being has emotions, they have physical, mental, spirit, and spiritual needs. Holistic care includes spiritual needs. And that happens throughout the lifespan, not just when you're young and working and uh, need hospitals. When you're in
Mhm.
nursing homes, you continue to have spiritual needs.
Mhm.
Perhaps more importantly now than ever before because of those deep questions that you're now turning to. You've been busy raising a family, having a career, and now in your twilight years, you start reflecting more. So, yeah, it's very important to have that. What can be done about that? There's a number of things I think that would help our society value spiritual care more. Um, and it's on both sides of the equation. Spiritual care providers, they have some work to do too. Right now, the situation is that uh, spiritual care is not a regulated profession, such as social work, your own profession. Doctors, nurses, they have colleges. There is a movement afoot now to have spiritual care join the College of Counseling Therapists.
Mhm.
We've made a submission to the government. It's being studied. We're awaiting word back. That having a regulated college would be one thing that spiritual care would benefit spiritual care because it would be kind of a public recognition of the training, the skills, the expertise that goes into this profession. And
Mhm.
that right now, anybody can call themselves a spiritual care provider. They can
Okay.
hang out a shingle. There is no um, requirement, no legislative requirement uh, that you have to meet. So to protect the public, it would be important to have a bar that you have to have at least this minimum training and education before you can present yourself as someone who can support vulnerable people with their deep needs. So that's
Mhm.
one thing we can do is make sure that all people who are in that profession of spiritual care have a minimum level of training and expertise to
Mhm.
protect the vulnerable. The other thing that can be done is that government can, to truly follow up on holistic healthcare, can include spirituality, can include spiritual care as part of the scope of all that's offered. That hospital would always have a spiritual care person as part of the treatment team. Right
Do you
now,
think there's a hesitancy to on the part of government to go there, or is that where
well,
is it
uh,
money, or is it the the hesitancy to engage with a faith-based aspect?
actually, here in Manitoba, among all provinces, we have a very strong faith-based organization, the Interfaith Healthcare Association of
Hmm.
Manitoba, representing most of the faiths in Manitoba.
Hmm.
We actually have an excellent relationship with the present government, past governments, the leaders of ICAM, as it's called, the Interfaith
Hmm.
Healthcare Association of Manitoba, work very hard to have good relationship with government. They secured funding for spiritual care positions. I look at other provinces, it's not always the case. In Saskatchewan, they actually cut 14 publicly funded spiritual care positions. That was about five,
Hmm.
6 years ago. Fraser Valley Health, another a dozen years ago, cut a similar amount of spiritual care people. So these cuts can just happen overnight as soon as the government decides they need to save money. So
Hmm.
here in Manitoba, I don't think it's as much ideological as it is budget, that it costs money and
Hmm.
to fund spiritual care, right? And we're often considered the icing. We're
Hmm.
the cherry on top. We're the nice extra. It's
Hmm.
not one of the kind of critical services. We're not essential services in often government's mind. So they have this difficult challenge of balancing their budgets, and there's only limited funds. Who do we give that money to? And
Hmm.
it's easier to fund a nurse, a doctor, or social worker than it is for a spiritual care provider. So we're often the soft science. There's not a lot of hard data. That's
Hmm.
another thing we can do is we can increase the research that demonstrates the effectiveness of good spiritual care on health outcomes.
Hmm.
So often government, they look at evidence-based research. What's the evidence that having a spiritual care provider on the team will help? So partly it's incumbent upon us as spiritual care providers to do that research. And we're a young profession. We don't have in-depth research on a lot of those things like medicine or nursing would. So that's part of our future challenge is to come up with a research that will make the case and make it harder for governments to say, no, we're not funding you.
Well, yeah, I mean, certainly through this conversation today, I've come to have a whole new appreciation for the ways that spiritual care providers can help everyone, whether they're navigating the healthcare system or the long-term care system. Um, but yeah, I can see that maybe that emphasis on hard data or evidence-based practice is a little bit of a harder, to generate in that field. But that doesn't mean that it isn't essential or valid.
You're right. And that brings us to another myth of spiritual care, which would be that we're like Prozac on legs. We're
Uh,
Dr. Feelgood.
uh,
We just hold hands and sing Kumbaya. We go down the hallway and we make people happy.
mm,
So that's like, what does spiritual care do? Well, often, sometimes you'll get a nurse to say, Mrs. Smith down in 14 bed 2, she's sad. Could you go talk to her? Like,
okay.
I mean, they want to help Mrs. Smith, but they have a role. They see the role of spiritual care people as cheering people up.
Mm,
Go make her happy. And if anything, the reality is just the opposite. That spiritual care providers often are the one people that are not afraid to go into the pain, to
mm,
speak about the hard things. Often I'm in a room and the families gather around the patient. It's just before heart surgery, and they're all saying, "Come on, Dad, you're going to pull through." And the patient is, "Well, what if I die?" And I said, "Dad,
mm,
don't say that. Don't say that. You have to be positive." So everyone's cheerleading for optimism. Everyone's kind of rah rah for good outcomes, which is good.
Hmm.
where does that person then speak about that deep fear they have about dying and I'm not ready? It's with the spiritual care provider. In fact, what happens is if they are able to explore their fears and to name the things that their family doesn't want them to talk about, they are actually more emotionally ready to face their surgery. They've done their work, they've done their psychological, spiritual work uh,
Hmm.
by naming that fear and exploring it and going through it instead of pretending it doesn't exist. So often chaplains are the ones who talk to the patients and there's tears, tears
Hmm.
of grief and loss, tears of shedding just from being able to name that something that they've never been able to talk about before. So rather than making people feel good, often we're the ones who make them feel worse initially so
Hmm.
they can feel better long term.
Hmm. Hmm. It's just interesting to think about how that the role for spiritual care and a real, holistic, multidisciplinary approach, looking at someone's physical health, but also their mental health, but then also their
Hmm.
spiritual health as well.
Yes,
Something
yeah,
that's overlooked.
yeah. Which brings me to another myth is that you mentioned that you're there for the patient. Out of all the professions in healthcare, we are the only ones that are there for staff. Like part
Ah,
of
for
our mandate
staff.
are for staff. We are the spiritual care for the, we're usually assigned to units. So I was assigned to say to palliative care, the dialysis, and a medical wing. When I'm part of rounds and or when I'm at the desk charting, the nurse will say, "Oh, can't wait for this day to be over. Oh, what's
Yeah.
going on? Oh, my son is sick, and I
Mm.
had to take time off work, and she's stressed and worried about a family situation." I said, "That sounds tough." Yeah, and then she starts talking. We're just often alone at the desk, and she unburdens herself about her family stress and her worries and her fears, and it's only 5 minutes or so, but someone heard her, and then she kind of said, "Oh." Well, that felt better. And then she goes about her job. So, in a way, becoming a listening ear to the staff to help them process what they're dealing with, the death
Hmm.
and the illness. Spiritual care providers are the kind of the chaplain to the unit or spiritual care for the doctors, nurses, allied health who work there. Uh, and they're a bit like
Is that
EA.
is that part of your mandate, or is that
It's
is
actually
that's not
part
out
of
of
our roles.
scope? Like
No,
that
it's
you're
not.
taking all the not only taking on, the patients, you're also taking on the whole team, the glue holding the whole unit together.
Yeah, and it's not that we're supermen or superwomen. It's
Right.
that we are present, though. Like there's the EAP, Employee Assistance Program, that most
Hmm.
institutions have for their staff. It's very different, though, if you say, well, call this number, you'll get an
Hmm.
appointment, and maybe in a couple weeks or so, you'll
Hmm.
get 4 sessions to talk about your stress. Most people, it's not either not that bad or it's situational. They would talk to a chaplain who's standing beside them at the charting table. They
Hmm.
won't call EAP to make an
Hmm.
appointment. So, in a way, the chaplain's presence on the unit at rounds is a way, a sign to the staff that you have someone you can confide in and talk to. It's not counseling where you go away for a 55-minute session. It's often much more casual in the flow of the day.
Hmm.
People, nurses, and allied health, they're too busy to take time off often in their workplace, but they can talk for 5, 10 minutes, take a coffee sit with the spiritual care provider and talk about,
Or they don't address it the first time or the 50th time, and then the first 51st time, it's a crisis. And if they had paused for a second and spoken to someone the way you're talking about, it might
yes.
not have built up to the point that it's a crisis.
And you're kind of naming resiliency, building resiliency and the ability to stay in difficult jobs. Like I think of someone who works in the ER, the nurses, doctors, allied health there, very stressful. And yes, that can build up, especially through COVID, and now
Mhm.
with people get mandated to work extra shift, they're short staffed. That builds up. It has to go somewhere.
People are
And
so upset with the healthcare system in general.
yes,
Yeah.
exactly. So they either you build up a thick skin and become battle hardened, or in order to have a caring, compassionate heart, you have to find some way to be at work, not collapse in a puddle,
Mm.
and yet not burn out and then find another job too. And we just saw some newspaper articles on how many nurses actually are considering getting out of the profession
Yeah.
because it is taking such a toll. So spiritual care providers can act as that, I won't say safety valve, but they can be an important listening ear right at the workplace. They don't replace EAP, there's still a need for that. However, they have this unique role that they are part of the team and yet are there for the team. What
Mhm.
I've noticed in my years is that when I was a young chaplain, I spent most of my time talking to the patients and families. As I matured and I got better at this, I found I was spending more time supporting staff.
Mm.
The reality in healthcare is that the length of stay is like 3, 4 days in a hospital. They come and go. They'll always be there. The staff are there year after year after year. To support a staff actually to cope with workplace stress or with cumulative grief,
Mm.
um, that can actually help a lot with retention and keeping staff at work and intact instead of just battle hardened. There's a way that if you have a good spiritual care provider, they can be instrumental in helping stressed out staff cope better with their positions and with all that healthcare brings and throws at.
Mm. Well, I mean, I've learned so much today through our conversation, whether it be the training or the background of spiritual care providers, the expertise that they have, the distinction between what you might traditionally think of as spiritual healthcare provider and what you've described for us, this additional role of how you are there also for the healthcare team, and the way you're there for the people in the healthcare system that are trying to navigate it, and it
Mm-hmm.
be acting almost as an ally of helping you know, people cope and navigate that
Mm-hmm.
system.
Exactly. Yeah. Mm-hmm.
Yeah. So I want to thank you. I want to thank you for taking the time and for, answering my questions and shedding some light and helping to break some of these myths, these misconceptions that people have about spiritual healthcare.
Well, it's been my pleasure, Trevor. I don't think we hit them all. There's lots out there still, more myths to break and to speak of, but we made a good start today. Thank you.
Okay. Thank you very much.